Sure. Sure.
Good morning, and thank you for being here. I always feel like this time goes really fast. It was just yesterday where you were here.
I know.
And here we are again. So thank you for being here. This is Cassandra from Everence. She's going to talk to you about the Medicare updates this year for 2026. So.
Yeah, time flies. Yeah, you're right. So my name is Cassandra Zetz, and I am a certified senior advisor and a financial consultant who specializes in senior health insurance matters, which is just a very long title that Everence has given me. That means I know a lot about Medicare. So I am here today to talk about Medicare. Oh, there we go. And I work out of our Souderton Everence office, so we are right down the road here. But Everence is a faith-based, member-owned financial services organization. Our home office is actually in Goshen, Indiana, and then we have offices all throughout the United States, as you can see there. There is an Everence fact sheet that is one of the pieces of paper that's on the table there you can grab, or if you did grab it, you can read through and see the different things that we do. But in general, Everence helps people with banking, financial planning, retirement planning, investment management, health insurance, and we've been doing Medicare supplemental insurance and Medicare education since around the 1980s. As an organization, we were called into being through our members, through congregations, and so we go where we feel we're needed, and we felt in the 1980s that this was a need of our communities, and so we've been doing that ever since. Today we're going to look at a few things. We're going to talk about the different parts of Medicare, just a basic reminder of what it is you have, what you started with. Then we'll talk about your coverage options, okay, what you've done on top of having original Medicare and what the other options could be. We'll talk about what is going on during this time of year. We're right at the start of open enrollment season. I'm sure you're being inundated with lots of information from lots of different people. So we'll talk about what to pay attention to, maybe what to not pay attention to, what you want to do during this time of year. And then we'll talk about scams and fraud. Never a bad time to talk about it, but it is particularly bad during this season. And so we'll talk about a few things to be aware of. Before I jump into the first part, I just want to let you know that I will definitely have time for questions at the end, but if you have questions during, feel free to ask, raise your hand. And Leah has a mic, I think, that she could bring around if you have questions for the good of the group or something that is just something you're wondering about. I was a middle and high school teacher for a while before doing this, so I'm very used to being interrupted. So please ask all the questions you want. But we're going to jump into it with some basic Medicare reminders. So when everyone gets onto Medicare, you start with original Medicare, which has two parts. It's one of the ways that Medicare is very different than a traditional employer plan. Usually all of your insurance is bundled into one plan when you're on an employer or individual insurance plan, but Medicare is broken into parts. Part A of original Medicare is for your inpatient services. So Part A helps to cover care in the hospital, follow-up short-term skilled nursing care, home health care if you qualify, and hospice care or end-of-life care. And with Medicare Part A, Medicare covers most, but not all of the costs. There is an annual deductible for Medicare Part A, and if you had no other insurance besides original Medicare, the deductible this year was $1,676, and you can see the projected deductible for next year is $1,716. So it's projected. They haven't announced it yet, but the Medicare trustees always project out a few years what they think the cost will be, so it will probably be something like that. Once you've met that deductible for your inpatient services in the hospital, there are then some copays and coinsurances beyond that. So if you stay for an extended time in the hospital, you can have daily copays, or if you go into a skilled nursing facility beyond 20 days, you can have some daily copays. So it just depends on how long you are going to be there, where you are, and if you have any additional insurance. The premium for Part A is free for most people. So most people do not pay a premium for Medicare Part A because it's really prepaid. We've been paying into that through our taxes, okay? Then Part B is the other part of Original Medicare, and these really go together. Some people who are still working might take Part A without Part B, but once you are retired or officially off of work insurance, you have to get the Part B of Medicare. And those two pieces together really create your core coverage, Part A and Part B. Part B is your outpatient services. On your Medicare card, red, white, and blue card, you'll see it listed as medical services, but it's really a large umbrella. It's pretty much everything that's not covered under Part A. So you've got your doctor's visits, your therapy, your lab work, diagnostic tests like MRIs and EKGs, and then anything that's considered an outpatient service, which a lot of things are now, knee replacements, hip replacements, any kind of injection or infusions in doctor's offices. So Part B is a really large umbrella. Most of your care is probably falling under Medicare Part B. There is an annual deductible for Part B as well. This year in 2025, it was $257. The projected deductible you can see there in 2026 will likely be around $288. So deductible means you have to pay that cost before the insurance kicks in. So $288 next year. And then once you've met that deductible, Medicare pays generally 80% of the cost of most of your services and 100% for many preventive services. There is a premium for Medicare Part B, and this year in 2025 it's $185. The projected 2026 is $206 per month per person. Now, this premium cost for folks who are taking Social Security benefits comes right off the top. It's a deduction. So it's kind of an invisible cost. You don't really maybe pay attention to the fact that you're paying it. You'll see it on your Social Security statements, but it's not something that's coming out of your bank account each month. So Medicare A and B are pretty comprehensive. They cover many, many, many services. Their general rule of thumb is that if it is medically necessary, they will cover it. But there are certainly some things that Original Medicare does not cover well. Things like acupuncture or even chiropractic care is typically not covered. Glasses, like your lenses or contacts and your vision checks, are not covered. Medicare does cover anything that has to do with the medical care of your eyes. So a cataract surgery, injections for macular degeneration, diagnostic testing is covered as medically necessary, but the test of your vision and the cost of your glasses would not be covered under Original Medicare. Same with hearing aids, some over-the-counter medications, and the big, big, big gap in Medicare is the dental. There is currently really no coverage for dental. Starting in 2024, if you are about to have a medical procedure and the doctor wants you to have a dental cleaning prior to that procedure to reduce the risk of infection, sometimes that's covered. But that's pretty much it in terms of the dental. And while I would love to say that I see them adding dental coverage sometime in the future, I don't think that will happen. So dental is currently the biggest gap when you have just Original Medicare. Generally speaking, the original Medicare program has been historically very steady. There are very few changes to the original Medicare A and B program in terms of how they cover and what they cover. One of the biggest benefits to having original Medicare rather than like a traditional employer or individual plan is that original Medicare is a federal program, so it's nationwide, there's no referrals, no networks, and very few prior authorizations. So, one big change that's coming, well, it's not super big, it's pretty small actually, but it is a shift from what original Medicare has typically done, is they are introducing a program called the WISER model, Wasteful and Inappropriate Service Reduction, WISER model, in 6 states. So you can see there, it's not Pennsylvania, so it's not impacting us. New Jersey, Ohio, Oklahoma, Texas, Arizona, and Washington. In those 6 states, they are piloting this program to test the use of prior authorizations within Medicare. Many people are not happy that they're even talking about it because, again, it's one of the best things about original Medicare is that there's very few, if any, prior authorizations. But what we know about the model is that it's going to last for 6 years. It's voluntary, so even within those 6 states, a provider has to opt in to this program. And the prior authorizations can only be used in services that can pose safety concerns or may have had high reports of fraud or waste. And so some of the examples there are skin and tissue substitutes, electrical nerve stimulators, and things like that. So it's not that they're just blanketing prior authorizations on top of everything, but it is, again, a pretty big shift from what Medicare is known for. So it's just something we're keeping an eye on, that this program is being piloted. Any questions about your core benefits, original Medicare A and B, so far? Okay. I'm taking a drink of my fancy water that you have here. What is it, peach and cinnamon? Peach and cinnamon water. Okay, we're going to talk next about Medicare coverage options. So you start with your A and B, but as I said before, Medicare generally covers about 80% of the cost of your services. And original Medicare on its own has no out-of-pocket maximum. So if you have just original Medicare, there's a lot of risk to that. So most people get something in addition to or in substitute of original Medicare. And these are generally the 2 paths that someone will take to try and increase their coverage or get more with their benefits. So on the left side, this is somebody who would have original Medicare as their primary insurance. You keep that red, white, and blue card there on the left. Add a Medicare supplement plan or a Medigap plan as a secondary insurance. So you have 2 insurances. Those supplement plans are given letters. So you can see on this example Aetna card, this is a Plan F. So if you're not sure what you have, Medicare Supplement or Medicare Advantage, looking at your card is a good giveaway. If you have a lettered plan, that is a supplement plan, and that works together with original Medicare. Often on this path, someone then also adds a standalone Part D prescription plan, and that's that example Cigna card there on the bottom. You can see it says PDP, prescription drug plan, on that card. So on this path, someone probably has 3 cards that they use for their healthcare needs. When you take this path, you are using original Medicare as your primary insurance. So original Medicare is deciding what's covered, is processing your claims, and then crossing them over to your supplement plan. They are approving or denying things as original Medicare, and again, they have no referrals, no networks, very few prior authorizations. The other option for folks when you get onto Medicare, if you want something beyond the original Medicare program, you can get a Medicare Advantage plan, which is also known as Medicare Part C. So as Part C, that just means it's the 3rd program that was developed in the Medicare world. We had A and B original Medicare. Part C was the development of this Advantage Plan program. What's important to understand about Advantage plans is that they are a replacement of your original Medicare. So you still pay your Part B premium to the government, everyone does, okay, once you're on Medicare. But by enrolling in an Advantage plan, you are now going to use that plan as your primary insurance. So in this example, ACME plan, ACME would now be processing your claims, approving and denying, making decisions about your care, okay? You probably still carry your original Medicare card with you, even if you have an Advantage plan. Most people keep those. But really, your coverage is being processed through your Advantage plan. The Advantage plan cards, if you're not sure what you have, usually have fun, different kinds of names. They're not letters. And they usually say HMO or PPO somewhere on the card because these plans can and typically do have networks. They also usually say Medicare RX somewhere on the card because they usually bundle in your prescription plan into one thing. Any questions so far on that? Okay, another way to look at these differences. So on the top here, we have a visual to show how the original Medicare and supplement plans work together. So they work in tandem. If original Medicare, your primary insurance, approves a claim, whatever supplement plan you have has to come in and pay on that claim. But the opposite is also true. If original Medicare does not cover something, the supplement can't cover it. So supplemental plans are there to fill in the gap of the cost, that 20% that you would be responsible for your approved services. Supplement plans are not meant to add benefits that Medicare doesn't have, like dental, transportation, eyeglass coverage, things like that. Again, because you're keeping original Medicare as your primary insurance, there are no networks, no referrals, very few prior authorizations. Any provider in the country that takes original Medicare has to take whatever supplement plan you have. So 98% of providers in the country take Medicare, so most people will see you. There's very few barriers to care with the Medicare program. And then once you are on that Medicare supplemental plan, it is guaranteed renewable for the rest of your life. Those benefits cannot change. So on the last slide, we saw the example of the Plan F that somebody had. That Plan F, once that person is on it, those benefits are yours for the remainder of your life. You cannot lose those benefits. They can't reduce those benefits. The only reason you could lose a supplement plan is if you stop paying for it. But as long as you're paying for it, it rolls right into the next year. And again, on this path, you'd have a separate, standalone prescription drug plan. Now, for someone who has a Medicare Advantage plan, again, this visual is kind of to demonstrate that idea that this is a replacement of your original Medicare. Medicare Advantage plans, through their federal contracts, are legally required to offer you coverage that is equivalent to original Medicare. So again, about 80% is what those sort of Pac-Man pieces are supposed to show there. So they are required to cover the same services that original Medicare would, but they are allowed to use their own criteria to determine if you need those services. So they get to decide what is medically necessary for them, and that's where those referrals and prior authorizations come into play. They can also repackage what that 80% looks like. So they might actually charge you a little bit more for a hospital stay than original Medicare would, but they can add some dental cleanings, some eyeglass coverage, some transportation. So these plans do often have some benefits that original Medicare does not have. Again, they're managed care plans, so networks, in and out of network, you could pay different costs. And then once you're on a Medicare Advantage plan, those change every year. or I should say, they can change every year. Your Medicare Advantage plans are going to be allowed to change their premiums, their coverage, their networks, their deductibles, all those kinds of things annually. In Pennsylvania, in our area, in 2025, there's over 60 different Medicare Advantage plans you could choose from. Next year, 17 of those are being canceled, but there's like 7 new ones. So there's lots of change with the Advantage Plan program you have to stay on top of. And then your prescription coverage is often bundled in with those plans. I usually get the question then, well, can I change? If I start with one, can I go to the other? What does that look like? The general rule of thumb is that if you have original Medicare and a supplemental plan, or if you just have original Medicare with no supplement, you can go to a Medicare Advantage plan every year, any year, during open enrollment season, which is October 15th to December 7th. Medicare Advantage plans do not require any kind of underwriting or health questions. They have to take anyone who enrolls during this season of open enrollment. And then that new plan will start for you January of the next year. But if you have a Medicare Advantage plan and you want to drop that and go back to having original Medicare and adding a supplemental plan, that is a little trickier. So you can try to do that anytime during regular open enrollment season, or even the Medicare Advantage open enrollment season, which is January through March of every year. You can try and get out of your Advantage plan and add a supplement. But we see that bullet point with underwriting. So underwriting is health questions. If you are trying to get a supplemental plan and you are not in what's called a guarantee issue period, then an insurance company is going to ask you health questions, and they do not have to take you on if they think you are risky. Supplemental plans offer a lot of coverage, right? Filling in most of that 20% gap that Medicare doesn't pay for. And they're guaranteed renewable, so they cannot get you off of that plan. So they're only going to take you on during a season when they have to, or if you seem healthy enough for coverage. There are, however, a few times when you can get a Medicare supplement plan without underwriting, without the health questions. It's guaranteed. If you have original Medicare and a supplement and you want to try a Medicare Advantage plan, I was at Doc Woods last week and someone said, I just got off the phone with someone from a Medicare Advantage plan and I have a Medicare supplement, but they made it sound really appealing. I might want to try this. If it's your first time trying a Medicare Advantage plan, you get what's called a 12-month trial right. So for the first 12 months that you try a Medicare Advantage plan, if you decide it is not right for you, you can go back to original Medicare and your supplement plan guaranteed with no underwriting. There are also some other caveats to that. You can move away from your Medicare Advantage plan coverage area. Because Advantage plans are managed care plans and they have networks, if you move outside of that network, they kick you off of their plan. They can't cover you there. So if you move out of your area, then you could potentially get into a different Medicare supplement plan once you move. The other event is happening a lot this year. As I mentioned, if your Medicare Advantage plan just ends, to no fault of your own, they just stop offering that plan, you can then move to obviously a different Medicare Advantage plan, but you could also get a Medicare supplement plan without health questions during that time. So I have talked to 3 people, I think, in the last week whose, I think it's an Independence Personal Choice Plan is ending in this area, and they are looking to potentially move to a supplemental plan. Any questions on the different coverage options? Okay. Next, we're going to talk about open enrollment season. Okay, what is happening during this season? Well, we do know that, as I said earlier, it's a lot of information coming at you at once, and some of these statistics are just really shocking. So we have up there, in 2021, there were over 41,000 complaints to the Centers for Medicare and Medicaid Services about the Medicare private plan marketing that was happening. In 2022, there were 9,500 daily television ads about different Medicare plans. And in 2023, 30% of seniors reported receiving 7 or more phone calls weekly from marketers. It is an aggressive time of year to be someone on Medicare. You are getting bombarded with information, and a lot of it is meant to make you feel like you're missing out on something, right? Like there's something out there that you could get. There's a limited time offer. You need to jump right now. You need to make a decision, and it can be really overwhelming, and it can make you feel bad, like you're not making the right choice. So my job today is to make sure you understand what your options are and that you're confident in what you're doing so that you don't feel overwhelmed or bad about the choices that you've made. So during this season, again, October 15th to December 7th, there are generally 2 things that you want to do. And if you are in Original Medicare with a supplement plan and a separate prescription drug plan, then this first option is what you want to do. You need to review and potentially make changes to your Part D prescription plan. Again, your Original Medicare and your supplement plan are guaranteed renewable. They're not changing. You don't have to sign something saying you want to stay in it. It just keeps going. So unless you specifically have an issue with your supplemental plan, the only thing you want to do during this time of year is look at the changes to your prescription plan and potentially make a change there. If you are someone on a Medicare Advantage plan, then you want to do option 2 here. You want to review and potentially make changes to your Medicare Advantage plan. Okay, that whole thing, again, can change every year. There have been, in recent history, some changes to the Medicare Part D program. Medicare's Part D program is the prescription drug program. It's Part D because it was the 4th thing that was developed, A, B, C, D. And D for drugs is the only letter that has any sort of sense to it. So Part D is the prescription drug plan program. There were some changes that started rolling out in 2023, and some of them are still coming. And these changes impact you whether or not you have a standalone drug plan or drug coverage bundled into a Medicare Advantage plan. So they impact everybody. And I'm just going to review some of the previous changes. So in 2023, there was a $35 cap on covered insulin. So if you're in a drug plan, yeah, we love it. If you're in a drug plan and that plan covers the insulin that you need, you cannot be asked to pay more than $35 for a month fill of that insulin. Also in 2023, no copays for covered vaccines. So the big one that year we got a lot of phone calls about was the shingles vaccine. The Shingrix vaccine was finally $0 for folks. Before it was 2 different doses and each of them was somewhere around $200, I think. So it was a great change in 2023. In 2024, the catastrophic phase of coverage, which just means you have paid a certain amount towards your drugs. Once you reach that certain amount, you are in what's called catastrophic coverage. It used to be that once you met that amount, you still had to pay 5% for all of your drugs. You're in something called catastrophic coverage and you're still paying. But in 2024, they changed that to 0%. So once you reach an out-of-pocket maximum, you no longer have to pay for your covered medications. This year, in 2025, they redesigned the Part D structure. There used to be something called the donut hole. Does that give anyone heart palpitations if I say the donut hole or the coverage gap? There used to be a phase of coverage that happened right before catastrophic coverage where suddenly you started to have to pay, it used to be full retail costs for your drugs, and then it was 25% for your drugs, and they finally removed that. So now there's just deductible, co-pays, and then you've reached an out-of-pocket maximum and you're in catastrophic and it's 0%. So they've really simplified the structure. And they also implemented a change to the total out-of-pocket maximum. In 2024, someone could have paid upwards of $8,000 out of pocket for their medications before they hit that catastrophic coverage phase. This year in 2025, that was maxed at $2,000. Couldn't pay more than $2,000 for your covered drugs. In 2026, next year, it will be $2,100, $2,100. So it is subject to inflation, so that out-of-pocket max is probably going to increase over time, but $2,100 is still a lot better than $8,000. So that redesign this year has helped a lot of people. They also implemented this year something called the Medicare Prescription Payment Plans, MPPP, or MP3, some people called it. And this allows someone to spread out the cost of their medications over the course of the year. So potentially, if you have a few very high-cost brand name drugs, you might have to pay that $2,000 the first time you fill your medication, or the first 3 months that you fill the medication, something like that. What the prescription payment plans allowed you to do was spread that out into smaller bills over the course of the year. It doesn't decrease the total amount you have to pay. You still would have to pay over the course of the year the $2,000, but it would be in smaller, more manageable chunks. So that was available this year. I haven't had a lot of clients using that, so I'm not as familiar with it. Haven't heard about successes or bumps with that program. It's all through whatever prescription drug plan you have. So if you have a WellCare plan, you would enroll in the WellCare prescription payment plan, and all of it is done through that company. And then this year, this upcoming year in 2026, they are starting the drug price negotiations. So I should say they've been working on the negotiations, but the new prices will be in effect in 2026. So it used to be that the government, the Department of Health and Human Services, was not allowed to negotiate the costs of drugs with the drug manufacturers. So essentially, whatever the manufacturer wanted the retail cost to be, that is what you had to pay. But they changed that, and essentially each year, starting in 2026, there are a list of about 10 drugs each year that are being allowed to be negotiated down. And so I'll show you the ones for this upcoming year in 2026. We've got some heavy hitters up here. We've got Eliquis, Jardiance, Xarelto, Januvia, Farxiga, and there's other ones as well. But these are brand name medications that don't have a good generic equivalence. And so you really didn't have an option other than to pay whatever the manufacturer was saying the retail cost was. So now that the Department of Health and Human Services has been allowed to negotiate these costs down, drugs, for example, like Eliquis, last year was a retail cost of maybe between $500, $600, $700 a month, 30-day supply, is going to be down less than $300 this year, is what we're seeing so far. You still have to pay that full retail cost if you have a deductible on your plan, before you meet that deductible, but it has certainly brought it down a good amount for folks. And then they're going to continue these. Next year, they're then negotiating for another 10 drugs, one of those being Ozempic, which is another big one. So we're grateful for these negotiations and getting some of the costs down. So, regardless of if you have a standalone prescription plan or you have a Medicare Advantage plan, that company has to send you every year what's called an annual notice of change, or an ANOC, annual notice of change. In that, they tell you what will be different next year. Because these companies are allowed to change everything about their structure, their premiums, deductibles, networks, and things like that, they have to notify you and allow you during the open enrollment season to make a change if this isn't sounding like it's the best for you anymore. So if you have a standalone prescription drug plan, that company sent you an annual notice of change. It's usually around mid-September, so everyone should have gotten theirs by now. And it would tell you what the premium for next year will be. It will tell you what the deductible will be, if there's any major changes to the formulary, their pharmacy contracts, things like that. If you have a Medicare Advantage plan, they are also sending you an annual notice of change and letting you know the changes to their premiums, their networks, their coverage, and their benefits. Those extra benefits like dental and eyeglass and transportation can change annually. So you really want to review those thoroughly and make sure that the plan still works for you. And if it doesn't, that is what you want to then move forward and find something better. Yes?
Supplement plans require send notices too?
No, supplement plans do not send annual notices of change because supplement plans don't change.
Yeah,
They're,
but the monthly premiums do.
sure, the monthly premiums,
Send you a notice about that.
yes, I believe so.
Haven't seen anything yet.
Okay. Well, that, you want to check on that for sure, yeah. So supplemental plans, benefits cannot change, but their annual monthly premium can change, and they should notify you about that, yeah, for sure.
Is there a requirement, legal requirement?
That's a good question, I don't know. No one's ever inquired about that before. I don't know that anyone's
Because it's open
not gotten it.
and we don't
Yeah.
have the information that anything's changing.
Right. Well, if you have a supplemental plan, you can change your supplemental plan any time of the year, not just during open enrollment season, because it requires the underwriting. So if you wanted to go from one supplement to another supplement at any time of year, you can try to do that with the underwriting. But if you wanted the Advantage plan, you would want that information now during open enrollment. So, if you get your annual notice of change and you're looking at it thinking, this doesn't sound like it's the best for me anymore, or I don't know what to do, I don't know how to tell if this is the best plan, we always recommend reviewing either your prescription plan or your Advantage plan every fall. And you can do this on the Medicare website. That is certainly the fastest way to do it. I know not everyone is comfortable on the computer, but the sheet that has the blue banner at the top is a sheet about setting up an online My Medicare account at medicare.gov. If you are even slightly comfortable on the computer, or you have a loved one that you visit with every so often and they are comfortable on the computer, or you have a social worker or a friend who is comfortable on the computer, this is a great tool. I really recommend an online Medicare account. It keeps copies of all of the plans that you're enrolled in, keeps copies of your claims, shows you where you are in your deductible every year. And during the fall, you can use that account to do a review for your plan. Even if you don't have a My Medicare account, you can still use the medicare.gov website. Medicare.gov/plan-compare will bring you to a screen like this. This lovely mustached gentleman is not there anymore. It's three happy women who are laughing together. But the plans, the page generally looks the same. The picture can change. But on the left, you can log in if you have a My Medicare account. But if you don't, right on the right here, you're going to start by entering your zip code. When you enter your zip code, it will ask you what kind of plans you want to look at. Are we looking for the best drug plan for you? Are we looking for the best Advantage plan for you? What are we looking for? Once you pick what type of plan you want to look at, you can then enter your medications, enter the pharmacies you want to use, and when you click compare, it pulls up all the available plans for next year in order of what's going to be the cheapest to what's going to be the most expensive for you based on your medications and pharmacies. It's about as accurate as you can get. It is all technically estimates. They can't guarantee a cost. You lost me. I can just yell if needed.
Does this?
Hello, hello. That's okay. Can you hear me if I just talk loudly? No?
This one doesn't work either.
Oh,
Hello?
I know, he's looking. The green light is on. Hello.
Hello?
I blew the speakers with my knowledge. Sure. Yeah, we can give it a try. Okay, that's fine.
Hello?
Hello. Yay, yay, round of applause. Thank you. Yeah.
So in these supplement plans,
Uh-huh.
if you wanted to change because of premiums or whatever,
Yeah,
they have to ask you these health questions. Many seniors have serious health issues.
correct.
So it's likely they're going to deny a lot of people to change.
Mm-hmm.
Is that
Yeah,
typical?
yeah, potentially. So when I'm meeting with someone who is new to Medicare, they are turning 65 or they're just now retiring and getting onto the Medicare program. When I talk about Medicare supplements, I talk about it potentially being the insurance you have for the remainder of your life. And that is the way to view it. And so in those meetings, my goal is to, again, make sure someone's really confident in the choice they're making, right? We can never be sure. Nothing with insurance is ever a guarantee. If anyone's telling you something's guaranteed, they're lying to you. But with the information that we have currently, your goal at that time should be to try and find something that you're going to be really happy with, not just at 65, but 75, 85, 95. Yeah, but I do get a handful of people who come throughout the year and are with a Mutual of Omaha or an Aetna or something that the premium has just gotten really, really high, and we go through the health questions and we're able to switch them. So it is possible, but there are definitely some red flags. And if you're curious, if you think you want to know if you think you'd get through underwriting, I can talk to you about that, and we can talk about what some of the red flags would be. Okay. Okay, so again, highly recommend going on, doing a review for yourself or or a loved one. If you're comfortable on the computer, you can be a very helpful tool for other people as well during this time of year. Once you get the gist of it, it is a very user-friendly tool. It does all of the work for you. It organizes everything for you. If you are not a computer person, you don't have access to a computer person, you're just not comfortable with that, there are some other options to getting a review done. You can always call 1-800-Medicare. They also have all of that information. The downside of that is you have to call Medicare, and you're calling a federal agency, and the wait times are very long, especially during this time of year. So they can certainly be helpful, but have your phone plugged into the wall and be ready to just, watch some TV or read something while you're waiting. Also, you could call your state health insurance assistance program. This is called SHIP. And each state has a different program. In Pennsylvania, we have PA Medi. And the sheet on the table with all the different phone numbers is the PA Medi phone list. Each county in Pennsylvania has a different number. And you can call them and schedule a phone appointment or sometimes an in-person appointment to do a review. They are funded through the state. They are nonprofit counselors, and they are using essentially the Medicare website to do the same thing, but they can do it for you. One of the great local resources we actually have two. The Indian Valley Public Library hosts a PA Medi counselor every other Thursday. So if you want to get a review done in person, you can try calling the Indian Valley Public Library and seeing if the PA Medi person has any available appointments yet through the end of the year. I was at Peter Becker a couple weeks ago, talked about that. The next day, a woman called the library and she got an appointment right for the next week and was able to get her review done this week. So that was a great tool. And then also Generations. If you know Generations, they also have a PA Medi person that comes on site sometimes as well. So 2 in-person opportunities there. And then again, if you have a social worker or a pharmacist or a family member or a trusted friend who knows what they're doing and they can help, then that's a great resource as well. Everence does have a Part D webpage. It's everence.com/Part D, PARTD. And on there is a video tutorial on how to use the website. There's also a PDF guide on how to use the website. And so some options there for you if you need it. Yes?
Everence has a $50 charge for a review. That's equivalent to this?
So yes, Everence does for our specifically for our Medicare supplement members, has a Part D service center that we staff every fall they can do reviews for you as well. But there is a fee, a $50 fee per person to get that review done. Same thing, they are, using the Medicare website tool. Okay, any other questions about reviews, what to look at this time of year? Okay, so we're going to end by talking about scams. Woohoo! Fun way to end it. So there are always new scams and fraud attempts and things happening every day, it feels like, for seniors especially. But this time of year, there is a huge uptick. I said earlier that I was at Doc Woods on Friday. A woman there raised her hand and said, well, we were talking about the annual notice of change. She said, well, I got a text that said it was from WellCare and said, did you read your annual notice of change and are you comfortable, reply with yes or something like that. That was a scam. WellCare doesn't do that. No one should be texting you about your annual notice of change. And then she even went to call the number back to see if it was a legitimate number, and it went straight to a voicemail that said something like, hi, this is Jen from WellCare, or something like that. And that's another hint that it's a scam. WellCare you wouldn't go straight to voicemail. You would get a phone tree. You would have to click a lot of buttons, and then you would be talking to lots of people. So there are always things going on, but especially this time of year. I'm going to talk about just a couple of things we see frequently. One of them is fraud. And fraud in the Medicare world typically happens in relation to durable medical equipment. So, this is when a scammer gets your Medicare number and then uses your Medicare number to order a bunch of durable medical equipment that you don't need and charges it to Medicare. So oftentimes this doesn't cost you anything because Medicare is covering these items, but it costs Medicare billions of dollars every year, durable medical equipment fraud. The best thing to do is keep an eye on your Medicare summary notices. They look something like this. They come every 3 to 4 months, talks about your claims that you've had. And if you're looking through that and you see, oh yes, Tri-Valley Primary Care, and oh yes, Grandview hospital stay. Oh, I did not order 70 catheters from a durable medical equipment supplier in Georgia. That's what you want to be on the lookout for. If something on there doesn't sound right, that is a clue that someone has your Medicare number and is using it to fraud Medicare. The other thing that can happen is sometimes those things will show up at your door. This was big during COVID, people getting a bunch of COVID tests at their door because the government was covering those at 100%. Anything that's showing up for you that you did not order, you don't remember ordering, is another red flag. So again, be on alert for anything that's inaccurate in your Medicare summary notice. Be on alert for receiving items that you did not request. And if this happens, the number one thing to do is report it to Medicare. Because when you report it to Medicare, they can flag that national provider identifier, the number of that provider, and they won't pay them anymore. And that's the most important thing that we want to stop. You can also call your supplemental plan if you have a supplemental plan and let them know so they can do the same thing, flag that provider and not pay them anymore. And if you're feeling really feisty, you can call the Department of Health and Human Services, the Office of the Inspector General, at 1-800-HHS-TIPS, and they can look into it as well. So durable medical equipment fraud is happening all the time. The other thing we've seen a lot this year is scam mail. They know that you have caught on to the fact that this intense advertising is aggressive, and many people are hanging up the phone, putting things in the shredder, not opening the mail. What they've now tried to do is create mail that looks like it's coming from the government. Make it look more official and less like an advertisement, and that way it prompts you to do something. So be careful, make sure you're reading through that information, look for anything that seems incorrect, look for anything that is, again, these limited time offers, and then at the very bottom of these, often in the tiniest print you can imagine, it says something like, you may be contacted by a licensed Medicare agent and not affiliated or approved by the US government. Those are really the telltale signs, but it's hard to see that sometimes. You want to be on the lookout for correct phone numbers. So again, a quick dial can tell you if you're contacting the right place, or you can Google the phone number. And program logos. If the government is sending you mail, they are legally required to put their logo on the envelope. Okay? So on the left, we have the Department of Health and Human Services logo. In the middle, we have the Centers for Medicare and Medicaid Services logo. And on the right, we have the Social Security Administration logo. So here is an example from 2023, but I have seen mail just like this year. And if you can read at the top there, it says, Medicare Part B reduction notice, pre-qualified, pre-approved for Americans turning age 71. So that doesn't sound like an advertisement. That sounds like the government is letting you know that your premium for Part B is going to be reduced for some reason, right? So this is an attempt to get you to fill out your information so that someone can sell you something. They do this also, I've seen with funeral insurance and lots of different things. But if we look at this closely, there's no logos, the information is incorrect, maybe you're not turning 71 or something like that. This phone number, I did a quick Google of that phone number and you just see a bunch of people saying scam, 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 scam. It doesn't pull up the Social Security Administration, which it should. We can also see down here, it says, please complete and return within 5 business days to receive information. This doesn't sound like I'm supposed to receive information. This sounds like I qualified for something, right? But you're going to get information. And then again, very small at the bottom, it says, this is not affiliated with or endorsed by the U.S. government or the federal Medicare program. You may be contacted by a licensed Medicare agent. So this is an advertisement. It's just a sneaky advertisement. And then they might say that they're selling a Medicare plan that they'll give you a rebate back towards your Part B or something like that. It's not that you qualified for something, it's that they're selling something. Okay, we are just at about 11. Are there any other questions for the good of the group? Yes. She's coming for you.
Is there anywhere we can find a list of the equipment that is covered? You hearing aids are out, glasses are out, etc. I had a hospital experience about a year and a half ago. Ended up saying to me, they said at the hospital, this walker is Medicare.
Yeah.
You won't have to pay for this. How would I get a walker to assist me? My CPAP is covered by Medicare. Why that and not hearing aids? I'm just wondering, how are those decisions made? And when is it covered and when is it not? We don't have any information on that.
Yeah, so you can use the Medicare website. There's a part of the website where you can type in a product and it will tell you if it's covered. You can also find durable medical equipment providers that take Medicare assignment. But generally, most pieces of durable medical equipment are. So you've got your, like you said, CPAPs, oxygen tanks, walkers, rollators. It's the main things that are excluded are the eyeglasses and the hearing aids. Those are the big pieces. And then there might be some other qualifications, like it will cover a standard rollator, but if you want a purple one, you know, you have to pay a little bit or something like that. And generally your provider will be able to tell you.
Second level to that question then is, if I'm paying for medical equipment, if I'm paying for it, is it tax deductible?
That I'm not sure. I'd have to look into that. Yeah, I'll have to talk to one of our financial planners upstairs. They would know, I'm sure.
I had a DEXA scan 2 weeks ago, and I got notified on my email that I owe $129. Now, I have Medicare plus a supplement.
Yeah.
I never had to pay for a DEXA scan, and you do have to wait 2 years, which I
Yeah.
did. But I thought $129 is a whole lot of money for DEXA, and they didn't send me a paper bill. That's what I don't like.
Yeah.
They do it everything on the
Digital,
phone.
yeah.
Go to this link. I don't like that. I don't trust that.
Yeah, I wouldn't either. Many providers are just bill happy and they just send you a bill without waiting for it to process through Medicare. I always recommend do not pay a bill until you have seen your Medicare summary notice and your explanation of benefits, because that will tell you whether or not that's covered. We get calls weekly of people who say, I got this bill, and we check in with our claims department, and they say, no, Everence paid that, they need to shred that bill. Providers sometimes just send things without being patient, and so
I should
wouldn't,
wait.
I would wait. I would wait, and again, if you met the qualifications of waiting the 24 months, it should be covered at 100%, yeah, so. You're right to question it. We're giving her a workout. She's getting all her steps in for the day.
Everence supplement plans, what's the expected increase for next year?
Yeah, we don't know yet. So Everence Medicare supplement plans, our rates, instead of going January to January, go April to April. And so we don't usually know in the field offices, we don't usually know until around February what the rates will be for the following year. I will say everything's been a little more expensive. What?
He has it,
Okay.
I have Aetna.
Okay, gotcha. Thank you for asking for him. Okay. If there are no other questions, I will hang out down here for a little bit. If anyone has some individual questions, I'm happy to chat. I also have some cards that I forgot to put out, so I'll put some business cards down there as well. But thank you for coming today. Appreciate you all making time.
Thank you for coming
Thank
again.
you. Yeah.